And the Health Minister has confirmed 240 aged care facilities will be included in the rollout of the Pfizer vaccine next week. Joining us for more on this is Craig Gear. He's the CEO of the Older Persons Advocacy Network. Craig, appreciate your time. Are those aged care facilities ready for the rollout? Have residents already started signing permission forms? Are you expecting most residents and staff will actually want to be vaccinated?
Yeah, so we're hearing that a lot of staff do want to be vaccinated. A lot of residents want to be vaccinated. And residents have been used to, I suppose, being part of the vaccination programs, either for the flu vaccine or might have been smallpox or polio in the past. But it's really important that people are having those conversations around what we say is a supported decision-making approach, to have a conversation with family members for people who might have that really vital role of power of attorney or medical guardian, to actually make sure that this is being done in line with the wishes and preferences of the older people. My understanding is that those facilities are starting in week 1 next week, which is really, really exciting. We're finally here with vaccines. They've all been contacted and they're working really hard to discuss these with the residents themselves and also discuss with family members about being able to get the first opportunity to have the vaccine.
And what about staff? Is it going to be a no jab, no job policy? Are most aged care homes actually going to enforce that as a rule?
Yeah, actually, I've been thinking through this myself about the importance of the vaccine and the community, I suppose, the community duty that we have to try and raise what often is Australia we're really good at high levels of vaccination. At this stage, no one's talking about mandatory vaccination from the provider point of view. What the providers are doing is trying to work with their staff to give them as much information as possible to be able to make those decisions. I think it's too early. You need to be able to have the idea of an accessible vaccine to have that we know it's safe and effective. We know that the TGA have signed off on that for provisional approval, but it needs to be available out in the community. So it's too early for those discussions.
We did see yesterday the AstraZeneca was also approved by the TGA. Were you reassured by the explanation we received by the regulator that this vaccine is safe and effective? Because we've seen a lot of debate over that and its efficacy for particularly older people right around the world.
Yeah, the discussion, we've been waiting on that information about, well, what does this mean for older people, who is what OPAN, the Older Persons Advocacy Network, who we primarily support through our 9 members. But it was really reassuring to hear that the TGA has approved that for children upwards, so there's not conditions on the age group. And I think people need to then, as the more information comes out, is do their research, get the credible information and have a look at the reports and how the TGA has made its decision. But we were really pleased that is going to be available to older people, because phase 1A is about residential aged care facilities and quarantine workers and staff in residential aged care. 1B is where the bulk of older people will be getting their vaccine, and so it's important for them to have confidence, and I think they can have confidence that the AstraZeneca will work for them if the TGA has approved that.
It does seem like some aged care homes around the country have very different standards when it comes to the restrictions that they have in place at the facilities. I know here in Perth there are some aged care facilities that are still requesting only 2 visitors per day, still asking visitors to wear masks, whereas there's no COVID in the community that we know of. All of the restrictions have been lifted after that lockdown a couple of weeks ago. Is that fair enough for those aged care providers to still be asking visitors to follow through with those protocols?
So, OPAN has called throughout the whole experience of COVID and the pandemic for aged care providers to think about the local risk in their community and to also follow the guidelines. We've worked really hard to get some best practice guidance in the industry code for visiting aged care facilities during COVID, and that's a good practice guide of what you should do to be able to balance the protections for older people, but also balance the need for older people need to be able to have visitors, and the visitors of their choice at the times they want. So the example you gave there, Ashley, of a Perth facility, there is no community transmission at the moment. There's a set of guidelines that's come out and been endorsed by the AHPPC that was worked very hard as a sector on, and providers should be following that. that tier 3 where there's a much more open ability to come and visit. That doesn't mean that there's still not safety mechanisms that are put in place. That doesn't mean that we still don't do the physical distancing and the hand washing and those sorts of things. That's going to be with us for a while. But the times of visitation, that needs to be much more freer. And we're here on 1800 700 600 if people are having trouble with their providers or want to raise an issue to be able to get visitation and get people back visiting older people and older people getting to see the people they want to see.
Craig, we've seen a lot more information coming out recently about aerosol spread of COVID-19 and a lot more debate in the community about that. Does that new information change how aged care facilities are now planning to deal with any further outbreaks? For example, does it suggest that anyone that catches COVID in an aged care facility should immediately be removed, sent to hospital, for example, to prevent that sort of further aerosol spread inside the facility? Because I know that was a really big issue that was debated during the Victorian outbreak when we saw the virus really run rampant through aged care facilities.
Yeah, and actually it's a good point. We keep learning more and more about the virus, which is a good thing. I think we knew that there was some level of risk with aerosols. I mean, the main thing, I'm not an immunologist and I'm not a public health specialist, but I do know that the droplet stuff that we've been talking about and the infection prevention and control measures that we've been asked to put in place personally, but also that aged care providers have been putting in place, was really to reduce that risk of droplets and possibly aerosols. And so that still is going to need to be followed. On the basis of the question about going to hospital, we've always championed that every older person has the right to access healthcare and clinical care that they need. We can't have a system that says just because you're old you don't get healthcare. So we've encouraged that that's been on a case-by-case basis and that we look at the local facility as well as looking at the wishes and needs of the older person themselves. So there will be cases where the older person will say, I'd actually rather stay here, but also to make sure that other people are protected from that. So there's not a one-size-fits-all on that, and it needs to be looked at the facility each time. But we have encouraged that there should be absolutely ready access to the acute health system for every older person in Australia.
Craig, yeah, appreciate your time. Thank you.
Thank you.